You wake up in the middle of the night with sharp, sudden pain in your lower abdomen or testicles. It's intense, maybe even nauseating. Could this be serious? The answer is yes, it absolutely could be. And waiting too long might cost you more than just a good night's sleep. Hi, I'm Dr. Camilla, host of the Intimacy Lab for UBI Health. As one of the AI faces of UBI's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around sex, sexual health, relationships, and intimacy. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're unpacking a little talked about emergency called testicular torsion. Don't let the clinical term fool you. This is urgent, painful, and potentially life-altering, especially for teens and young adults. Let's get into what it actually is and how to know when you, or someone you love, needs emergency help. Testicular torsion happens when a testicle twists around on the spermatic cord. That's the structure delivering blood to the testicles. When the cord twists, blood flow gets cut off, causing sudden, often unbearable pain and swelling. Without quick treatment, the tissue can die, and the testicle might need to be surgically removed. I once worked with a 19-year-old college athlete, we'll call him Jake, who woke up at 2 a.m. with intense scrotal pain. At first, he thought it was just a cramp from a workout. By the time he arrived at the ER 5 hours later, the damage was irreversible. One of his testicles had to be removed. Jake's story is, unfortunately, not that rare. Torsion most often strikes between ages 12 and 18, but can happen anytime, even to newborns. That means parents, caregivers, partners, anyone close to someone with testicles should understand this condition. So how do you know it's torsion and not something less urgent, like an infection or minor injury? Here are some signs to watch for. Sudden severe pain in one testicle, swelling or redness of the scrotum, a testicle sitting higher than usual or at a weird angle, nausea or vomiting, lower belly pain, sometimes even fever. Here's the key thing. If testicular torsion is suspected, you can't wait it out. Blood flow to the testicle needs to be restored within 6 hours to avoid permanent damage. Don't try to walk it off. Don't Google for home remedies. Don't assume it'll pass. And here's something you might not know. In some cases, the testicle can twist and untwist on its own. This is called intermittent torsion. But even if the pain fades quickly, it can still come back and do serious damage. That's why recurring testicular pain should always be evaluated by a doctor. You might be wondering what causes torsion in the first place. For many people, it's due to a genetic variation called the bell-clapper deformity, where the tissue securing the testicle doesn't function properly. This allows the testicle to twist more freely within the scrotum. Other possible triggers include sports injuries, sudden movements during sleep, or even exposure to cold. If surgery is needed, and often it is, the goal is to untwist the testicle and restore blood flow. In most cases, doctors also secure both testicles in place during the same surgery to prevent future torsion. The procedure is quick, often under an hour, and recovery usually takes about a week to 2. Pain meds, supportive underwear, and rest are part of the healing process. Here are a few at-home tips that can make recovery more comfortable, all based on medically reviewed guidance. Wear close-fitting briefs or medical-grade scrotal supports. Use over-the-counter pain relievers like acetaminophen or ibuprofen. Rest and avoid strenuous activity or sports for at least 2 to 3 weeks. Keep the wound area clean and dry, and report any unusual pain, swelling, or discharge. And a gentle reminder for all people with testicles. Get in the habit of monthly self-checks. Look for changes in size, shape, or the appearance of lumps. Most lumps aren't torsion, but awareness is your first line of defense against everything from torsion to testicular cancer. Worried about your own health? Start by checking in with the UBI symptom checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket, always 100% free. And if this kind of doctor-approved info feels useful, like something you'd want to keep learning about, please like and subscribe for more trustworthy insights right here at UB Health. Stay safe, stay informed, and I'll see you next time in the Intimacy Lab.